Childbirth. It is important that the first aid responder be familiar with the complications of pregnancy and the processes of childbirth. Delivering a baby in an unplanned situation can be very difficult, so where possible, get to a hospital. If you are called upon to help with an emergency birth, your role will be to support the mother, ensure the ambulance is on the way, and care for the mother and baby after the birth. Diabetes. Diabetics don't produce insulin properly, which makes their blood glucose or sugar levels higher. They need to regulate the amount of glucose in their body by medication or diet. Many have a medical alert bracelet, necklet or warning card and carry sugar, lollies, glucose or a ready-made hypo pack in case of an emergency. Problems are caused when the sugar levels are too low, usually from too little food, too much exercise, alcohol or too much insulin. Common feelings are confusion, lightheadedness, dizziness and weakness, trembling or shaking. They may experience sweating, headaches, lack of concentration, irritability, hunger, numbness around the lips and fingers. Conscious casualty. Make them comfortable. If safe to do so and they can swallow, give high energy foods such as sugar, honey or a glucose tablet. Unconscious, drowsy or unable to swallow. For a diabetic, this is an emergency. Place them on their side, clear their airway and call an ambulance immediately, stating a diabetic emergency. Heart problems. Pulmonary edema. The heart and the lungs are unable to pump the blood around the body, causing a backup of fluid in the lungs. This is often referred to as fluid around the heart. Congestive cardiac failure. The heart can no longer pump effectively and the casualty becomes seriously ill. Angina. Insufficient blood flow and oxygen to the heart muscle due to narrowed arteries. Depend on the severity of the conditions, casualties must rest to reduce the workload of the heart. They may also be prescribed to a drug called Angina to ease the pain. Heart attack. A sudden blockage of one of the coronary arteries that supplies blood to the heart muscle, resulting in an immediate life-threatening risk. If not corrected quickly, there is a risk of serious permanent heart muscle damage or death. Urgent medical care is required. A heart attack is different from, but may lead to, cardiac arrest. Not all heart attacks are accompanied by pain. Some casualties simply look and feel unwell, and some may dismiss their symptoms as indigestion. More commonly though, they will feel a constant, dull, heavy pain or discomfort in the centre of their chest, described as tightness, heaviness, fullness or squeezing. Call an ambulance immediately. If possible, stay with the person and call for assistance to get medication.